Hi everyone. Today I will be talking about the Shakir exercises. So what are the Shakir exercises? Otherwise known as the head lifting exercise. It's an exercise in which the patient rests in a supine position and lifts his or her head to look at the toes to facilitate an increased opening of the upper esophageal sphincter through increased hyoid and laryngeal anterior and superior excursion. Another way of saying this is just that they are increasing the diameter of the UES as well as increasing their hyolaryngeal elevation. There are a few variations of the Shakir exercise, the first being the sustained Shakir exercise, in which the individual is lying down flat on their back and tucking their chin to their chest so that they're looking at their toes for approximately 30 to 60 seconds, and it's followed by a 30 to 60 second rest period. This is typically repeated 3 times. The next is the repetitive Shakir exercise. Similar to the sustained, the individual is also lying down flat on their back and tucking their chin to their chest so that they're looking at their toes. The difference here is that this head lifting movement is done repeatedly for up to 30 repetitions, approximately 1 second each repetition. Again, this is followed by a 30 to 60 second rest period, and 3 sets of 30 repetitions is the goal. If the positioning for the repetitive Shakir exercise is uncomfortable for a patient, they may consider performing the alternative repetitive Shakir exercise. This differs in the way that the individual is sitting upright to perform this, and they will have one arm locked on their side, and they'll place a stress ball under their chin to apply pressure downwards towards their chest. This is repeated again up to 30 repetitions, approximately 1 second each repetition. The purpose of the treatment. This treatment is used to aid in the strengthening of muscles that are responsible for hyolaryngeal elevation that aids in the opening of the upper esophageal sphincter, and it helps in reducing pharyngeal residue, most commonly found in the piriform sinuses. It's intended for individuals who exhibit reduced superior and anterior hyolaryngeal movement, and often individuals who have abnormal UES opening or have sustained a stroke are good candidates for this treatment. The theoretical basis for this treatment, it was developed by Dr. Reza Shakir, a gastroenterologist who is based in Milwaukee, Wisconsin. He places emphasis on the UES being critical to breathing and swallowing, as well as the opening of the UES being reliant on the suprahyoid muscles. These muscles would include the mylohyoid, geniohyoid, and digastric. Dr. Shakir theorized that if these exercises were performed regularly for an extended period of time, it would strengthen the suprahyoid muscles in order to increase the diameter of the UES during a swallow. As a result of this, it would also reduce the amount of pharyngeal residue and amount of aspiration observed in patients. In an article written by Dr. Shakir, the practice of Shakir exercises versus sham exercises was compared in a pool of 27 participants. Of those 27 participants, 18 were able to participate, and those that were excluded included those that had a history of cervical spine injury, had a tracheostomy, or were unable to independently perform the exercises. The participants were randomized into 2 groups. The first group was those that would perform the sham exercises, and the second group was those that would perform the real or the Shakir exercises. Each group performed their specific exercises 3 times a day for the span of 6 weeks. Following the 6-week period, improvements in participant swallows were measured by video fluoroscopy. It was found that the sham exercises did not bring about any significant changes, whereas the patients performing the Shakir exercises exhibited significant increases in their antero-posterior UES diameter. Another study performed by Choi et al. Examined 2 groups, in which one group was to only perform conventional dysphagia therapy, while the other was to perform a combination of conventional dysphagia therapy in addition to the Shakir exercises. A group of 31 participants were involved in this study for the course of a 4-week period. The penetration aspiration scale and the functional oral intake scale were used to measure participant swallows prior to and following treatment. Both of these scales are Likert scale based, with the PAS being an 8-point scale, in which a higher score indicates higher aspiration severity, and the FOIS being a 7-point scale, in which level 1 indicates complete impairment of oral intake, and level 7 indicates that the patient has complete oral intake regardless of food consistency or type. While both groups improved their scores on both scales, the experimental group showed greater improvement over the control group as they demonstrated significant differences in their scores for both scales. How to perform the Shakir exercise. First, you will lie flat on your back against a flat surface, for example, the floor, while keeping your shoulders flat on the ground. Lift your head and tuck your chin to your chest so that you're looking at your toes. This position will be held for approximately 30 to 60 seconds, followed by a 30 to 60 second rest. Repeat this exercise 3 times. Next, you'll repeat the same head lifting movement, this time for 30 repetitions, approximately 1 second each repetition. Again, follow with a 30 to 60 second rest. And repeat 3 times. As mentioned before, if positioning for the repetitive exercise is uncomfortable, consider trying the alternative repetitive Shakir exercise. This set of sustained and repetitive exercises is to be completed 3 times daily for a span of 6 weeks in order to see significant results.
The purpose of the Shakir exercise is to assist with laryngeal elevation, opening of the upper esophageal sphincter, and decreasing pharyngeal residue. The sustained exercise, you would lie down on your back. Do not use a pillow, as your shoulders must be flat against the surface. While keeping your shoulders flat, lift up your head, bringing your chin down to your chest. It helps to look at your toes. Stay in this position for up to 60 seconds, and then lower your head and rest for 60 seconds. Repeat these steps 3 times.
This was a video demonstration of the sustained Shakir exercise. Very similar to that would be the repetitive Shakir exercise. The only difference would be the repetitive is done a little bit quicker and it is not held for as long of a period of time as the sustained. The next video will demonstrate the alternative repetitive Shakir exercise in case a patient is uncomfortable with the positioning for the typical repetitive Shakir exercise.
The alternative version of the repetitive Shakir exercise requires you to have a small stress ball. You will lock your arm against your side, place the ball under your chin, press down with your chin on the ball, hold for 1 second, repeat up to 30 times. For more information
Again, that was just a demonstration of the alternative Shakir exercise in case the typical repetitive positioning is uncomfortable for a patient. And some goals to consider if we are working with a patient that is targeting this treatment. The patient will increase hyolaryngeal elevation through the strengthening of the hyoid muscle through utilization of daily Shakir exercises for a 6-week period. And the patient will successfully complete 1 set of sustained Shakir exercises and 1 set of repetitive Shakir exercises daily in 2 out of 6 opportunities with minimal cueing. As mentioned before, if the repetitive Shakir exercises are uncomfortable, they may be modified to be performed as the alternative repetitive Shakir exercise. And if that's the case, then this goal would just include 1 set of sustained and 1 set of alternative repetitive Shakir exercises. And here are some of my references. I will upload my handout to Canvas, and thanks.